And welcome back to Dr. U Update, and I'm Dr. Noah, your host here. And what I do is I go through the scientific literature and try to find out things that I think are very, very important that you can take, empower yourself, that's going to have a great consequence in terms of your health and well-being of yourself, your family, and friends here. Well, this just kind of came out. This is from the New England Journal, American Journal of Clinical Nutrition, I stand corrected. Let's ask the question, diet drinks. Out there, they're everywhere. Everybody, we've talked about it. Everybody thinks there's no scientific evidence you ever lose any weight. Two is, it's again artificial. Maybe that's not the best thing for you. Well, here's a study that just came out. It's over 2 million person years. That's how big the study is. And they were showing that just drinking one diet soda a day increases leukemia by 42%. Multiple myeloma, which is basically a very, very serious type of cancer like that, 102%, and non-Hodgkin's lymphoma by 31%. So here you're drinking this crap that doesn't work, but they make lots of money, and once again causes cancer. Nice! So that just came out. Here's the actual study here. You can kind of read it. Once again, it's published in the American Journal of Clinical Nutrition, peer review journal, October 24th, 2012. That's right. That's why when your drug doctor, you talk to him or her, they won't know anything about it because, yeah, this just happened a couple days ago, and they still haven't had their drug rep come in and tell them what they need to talk about. Another article in the most prestigious medical journal. Well, we've talked a lot about this. Cancer is a big multi-billion-dollar type of industry. We're just ending up today's happy Halloween to everybody. I hope you eat some good things, but little treats once in a while aren't too bad. Is that cancer, breast cancer. This is October Breast Cancer Week, and people are running and making quilts to save those poor women. And I'm being facetious. Breast cancer is a serious disease. Women die, but unfortunately, the falsehoods, the mutilation, the poisoning, the disgusting type of attitude they have for women is just beyond belief here. Well, in this study here, and once again, the most prestigious medical journal in the world, says chemo benefits wildly overhyped by cancer specialists. That's right. There's no science. We talked about one of the largest studies on chemotherapy, the increasing the 5-year survival time for someone that has cancer. Let's get at best 2.1%. I mean, no other industry could come around and boast like that over 5 years I'm going to be able to help about 2.1% of the people. You would be looked at as a quack, which, hey, maybe they are. So in this study, it just showed that 69% of terminally ill lung cancer and 81% of terminally colorectal cancer patients, once again, were falsely told, like, if you don't have chemotherapy, you're just going to die. This is going to get and kill. There's no science to support that, and that's what this comment. Let's see if I can find the actual comment here. It actually leads a scientist there. There's a lot of harm in not having patients understand the finality of the disease. That's right. This isn't going to make you live longer. This is just making money, making you sick, and playing this once again disgusting type of thinking that you need to do this. Now once again, they make lots of money, $200,000 to $300,000 a year, a cancer type of patient. So once again, very, very disgusting. Here's another one with cancer here. Just came out, Cancer Prevention and Research Institute of Texas, one of the largest publicly funded promotion of conventional cancer research and drug development, which is worthless. 33, including the chief scientific officer, resigned. Why? Because they're totally disgusted that cancer is all about making money. Nothing about science, nothing about really making things work, because once again, it's all about making the big buck. And you have to wink, you have to nod, you have to tweak it a little bit more to maybe make it look like it's science when it's not, and like that. So that just kind of came out. And they resigned because of commercialization and once again, supporting a new cancer drug. Yeah, that's nice. The drug companies come in and say, hey, you guys are supposed to be a legitimate type of organization, but hey, we'll slip you a couple, $18 million, and you wink, nod, you make it look like we can make billions, and hey, we'll keep doing this type of thing. And at least there's some integrity out there. We talked a little bit earlier about that's where, unfortunately, science has really kind of broken my heart. When I was growing up in the 60s, I looked at scientists as, once again, looking for knowledge, looking for the answers. Now, they're still out there, but once again, just like this, more and more cases like this. prostitutes from the scientific medical profession. They'll say anything, do anything to make a buck or so. And that's, once again, another perfect example of what's kind of happening out there. So when your quack comes in and tells you, you need chemotherapy, we already talked about how it's worthless, and how, once again, the raw data is once again falsified. You're the one that's going to basically have the impact, not me. You're the one that's going to die a needless death and agonizing because, once again, making bucks. This is one of my pet peeves, which I've been talking about for quite some time. The typical medical checkups. I mean, yeah, you got to go see your drug doctor every year. Unfortunately, there's only 5, and they're all consistently 5 same things, that they're worthless. Now, they cost $300 or $400, so the doctor's happy about that. It costs society tens of billions of dollars that rip us off for something that's worthless. So in this latest type of study, medical checkups fail to, once again, do what you expect, reduce death. That's what you go there for. You want to try to find things like heart disease and cancer, catch it early because then they can get in there and do stuff. Once again, no such studies. So a very prestigious type of journal called Cochrane Library, where they looked at, once again, pooling the initial 9 scientific trials, 11,940 deaths, showed that, once again, there was, nothing there. We think it is, this is a little political talk here, they know it's worthless. We think it's unlikely that health checks reduce mortality to a degree where it would be beneficial. No, there's no studies. I happen to go on just in about 5 seconds. Here's another article. Now, this is in 2006. Now, figure that 6 years later. Now, and there's 4 other studies, this is the 6th study, that showed the same thing. Physical exams are worthless. But once again, it keeps going because it makes money. You're the fool that thinks you're going to basically go there and find out something. But maybe if you had to pull out of your pocket, $300, and we've talked about that. That's the problem. No one sees this once there's corruption taking place. You just think, except for our grandkids, which will have to pay for this credit card. So this is the demise of the physical exam. This is a doctor. This was published in New England Journal of Medicine also. He's only an MD, PhD. This article, once again, stated conclusively that, there is no benefit in terms of doing a physical exam. Once again, it's just hocus pocus. It's just, once again, it's a facade. So it just shows you, once again, the classic study that just came out, 3 months ago, 1.2 trillion, that's a 1 with 12 zeros, of the waste, worthlessness, harm that the medical profession does. Now, to keep this in mind, once again, if we put that in a piggy bank for 6 years, instead of, once again, doing worthless stuff like this for only a few people that make a buck, everybody in the United States would have a free house. So you have a choice. Worthless exams, worthless cancer treatments, all made for a few people, or everybody could have a free house. So that's what you got to start thinking here. And once again, if you had to pay for it, maybe that would be different. So thanks for watching Dr. Yu Update, and happy Halloween to everybody.
Free house.
Free house, exactly.